sutures in surgery outline. Introduction. A suture is any material that is used to oppose tissues and ligate bleeding vessels. It is used to support a surgical wound before the process of wound healing enables the tissue gain enough strength to keep the wound edges opposed. Most surgical or traumatic wounds require skin closure of some kind. And presently, there are so many numbers of sutures that are used in surgery. Therefore, to appropriately choose a suture type, it's necessary to understand the characteristics of different sutures. Sutures can be twisted, braided, or coated with materials to enhance their function. They could be dyed also for color coding. Some have antiseptics impregnated in them to prevent infections. Others have needles attached, while some can be used with free needles. However, different kinds of materials have been used as sutures. Due to the ubiquitous use of sutures in surgery, it is important, however, to understand its uses and proper usage for optimal surgical outcomes. As a brief history, historically, some form of wound closure mechanisms have been employed over the years, and some were similar to modern day sutures. Through many millennia, various suture materials have been used. In the past, before the Common Era, needles were made of bones or metals such as silver, copper, aluminium, bronze, wire. Some needles they had eyes in them where sutures were passed through to use in suturing, and suture materials were gotten from plant materials and animal materials like hemp, flax, hair, linen, grass. The earliest reports of surgical sutures date back to 3000 BC in ancient Egypt, and the oldest known suture is in a mummy from 1100 BC. Schuster described suturing with materials made of bark, tendon, hair, and silk in 500 BC. Other famed surgeons, however, also described using primitive sutures like Galen, Antyllus, and Lister and Parry. It's worthy of note that it was Joseph Lister that endorsed routine sterilization of suture threads, and sterile catgut was achieved in 1906 with iodine treatment. At one point, the mouths of pincher ants were used to approximate wounds before the modern suture was devised, and in the 20th century, there was massive production of numerous absorbable and non-absorbable synthetic sutures. However, today, most sutures are made of synthetic fibers. So let's talk about the properties of an ideal suture. An ideal suture should be sterile, should not harbor any bacteria to prevent infections. It should be inert to prevent tissue reaction between the suture and body tissues. It should not affect the tensile strength of the wound to prevent wound breakdown. It should be able to make a good knot. It should maintain its tensile strength indefinitely, and it should disappear as soon as its function is accomplished. However, it's worthy of note that a material that entirely satisfies all these properties is yet to be discovered. Various types of sutures that we use currently and presently include nylon or polyamide, polyglactin 910, commonly called Vicryl. Then there's catgut, which can be plain, and there's chromic catgut. There's linen, there's polydiaxanone suture, or for short, PDS. There's stainless steel suture, silk suture, proline, Dexon, cotton. So let's talk about the classification of sutures. Generally, there are three major ways of classifying sutures. According to the source, can be classified into natural or synthetic sutures. According to the structure, it can be classified into absorbable or non-absorbable sutures. According to the fate, it can be classified into absorbable or non-absorbable suture. Then according to the structure, it can be classified into monofilament or multifilament sutures. So for natural sutures, they are made from natural products. Examples include catgut, silk, cotton, linen, steel sutures. Catgut is made from the submucosa of sheep intestine or the serosa of cow intestine. That's plain catgut. Then some of it are coated with chromium. That's the chromic catgut to reduce tissue reaction. Silk is made from raw silk natural protein from silkworm. However, it's worthy of note that natural sutures usually cause a lot of tissue reaction. For synthetic sutures, examples like polyglactin 910, that's Vicryl, PDS, proline, nylon, Dexon. These ones are made from polymeric synthetic materials, and they cause minimal inflammatory reactions. They can be manufactured as monofilaments or braids. They can be coated with wax, silicone to allow smooth passage through tissues and for secured knotting. They may also be impregnated with an antiseptic to prevent post-op infections. Absorbable sutures are those that lose majority of their tensile strength within 60 days. Examples include Vicryl, Cascot, Dexon, PDS. Sorry, that's a mistake. They are biodegradable and do not remain forever in tissue. They disappear after biodegradation. The absorbable sutures usually cause minimal reaction as they are reabsorbed. Biodegradation usually occurs by proteolysis for natural sutures, and it occurs by hydrolysis for synthetic sutures. For non-absorbable sutures, for this type of sutures, their tensile strength persists for longer than 60 days. And examples include nylon, prolene, stainless steel, silk. They're usually ultimately encapsulated or walled off by the body's fibroblast. The synthetic ones, like nylon and prolene, they remain almost indefinitely in tissue, while the natural ones fragment after some years and may be degraded or get extruded from tissues. When used for skin, they must be removed after some days post-op. Monofilament sutures, examples like prolene, nylon, PDS, chromic catgut. This is based on their structure. The thread is made of a single strand. However, the strand may be a regular strand, like in prolene and nylon, or it could be twisted, like in chromic catgut. So, because it's a single strand, it does not have crevices that harbor microorganisms. However, during use, it requires more skill in tying the knot securely. For multifilament sutures, examples include vicryl, silk, and these ones they have several filaments that are compacted, braided, or twisted to form the suture. Generally, they have good handling and tying quality. However, some organisms may lodge in the spaces between filaments and as such predisposed to infections. So let's talk about features of sutures. First is the tensile strength. This is the average time span it takes for sutures to maintain their hold on tissue that they are opposing. For example, like in plain catgut, the tensile strength is lost within 2 to 10 days. For vicryl, is lost within 5 to 6 weeks. Dexon 3 to 4 weeks, PDS in 9 to 10 weeks. So that means by the end of this time frame, the sutures are unable to maintain their hold on tissues appropriately. The next feature is suture absorption, and this is the average time span it takes for absorbable sutures to be completely degraded in tissue. For vicryl, is 60 to 9 days. That means after this time, the sutures become they are degraded and then they disappear from tissue. The next feature is suture memory, and this is the ability of a suture to return back to its original packed shape when handled for use. That is, usually when sutures come, they're usually rolled in the pack, and when you remove the suture from the pack, the ability of the suture to maintain that rolled shape, that's the suture memory. And this memory usually affects suture handling, as sutures with high memory are usually difficult to handle. For example, nylon it has a high memory compared to other sutures, and thus it has poor handling properties. Silk, on the other hand, has a low memory and is so good in handling. So suture size is very important to note because we use this in determining the type of sutures that we're going to use, and it denotes the diameter of the suture thread. The reference for the size is O. So sutures bigger than this are numbered 1, 2, 3, 4, 5. Then sutures smaller than this in diameter, that's smaller than O, they are numbered with increasing numbers of O's. For example, if you've been in theater before, you heard of maybe Vicro 2O or 3O. So the higher the numbers of O, the smaller the suture. So 2O is smaller than O, 3O is smaller than 2O, and so on. So the combination of O's are designed as the figure representing the number of O's followed by the O. So that means for a suture that has 4 O's, so it's like Vicro 4O instead of saying Vicro O O O O O, something like that. So the smaller the size of the suture, the less tensile strength that the strand will have. So let's talk about the principles of suture selection. So while there are many properties to sutures, it's important to be able to determine which sutures are best for individual clinical scenarios. And this determination depends on the thickness and location of the tissues, the amount of tension across the wound, and the risk of infection. It's important to choose the appropriate caliber, the type of filament, and the tissue and needle required. So generally, there is no specific algorithm for suture choice. However, certain rules are helpful. For example, for running intradermal sutures, thin monofilament absorbable sutures with minimal reactivity are typically used. However, when suturing the skin, particularly in cosmetic sensitive areas, the smallest suture for the area should be used. So tissues that heal slowly like fascia, tendon, should be sutured with non-absorbable sutures, for example, nylon, or with sutures that have extended wound support like PDS. While tissues that heal rapidly like stomach, colon, bladder should be sutured with absorbable sutures, preferably with a shorter half-life. For example, like Vicryl can be used in suturing, and and if you notice, these are organs that you don't have to go back to remove the suture. So you want to use an absorbable suture that will disappear when it's no longer needed. So generally, we use monofilament or absorbable sutures in potentially contaminated tissues, and we avoid the multifilament sutures in wounds that maybe that have potential to become infected. So where cosmetic result is important, the use of the smallest inert monofilament suture is advised. Also, for cosmetics, we avoid skin sutures and close subcuticularly. Like for example, in excision biopsy of a fibroadenoma, while you're closing this around the areola where the incision was made, because of cosmetics, we avoid skin sutures and we close subcuticularly. And in urinary and biliary tracts, we use rapidly absorbed sutures to avoid stone formation. And regarding suture size, you use the finest size commensurate with the natural strength of the tissue. You don't want to use like a large suture size for a thin tissue. So for repairs that require a lasting tensile strength, for example, repair of a hernia, we use a non-absorbable suture that is preferable. Stainless steel sutures generally is used in opposing bones like in median sternotomy. So I'll just briefly talk about the Jenkins rule, because generally skin and soft tissue they can lengthen significantly under strain. So to accommodate for this lengthening, continuous stitches must have an adequate amount of slack so that it doesn't affect the wound healing. So the Jenkins rule is a rule for closure of abdominal wounds, and it states that for a continuous suture, the length of the suture used should be at least 4 times the length of the wound, with the sutures 1 centimeter apart, with 1 centimeter bite of the wound edge. That means if you're going to close an abdominal wound and you're using a continuous suture, the suture that you will use should be at least the length of the suture should be 4 times the length of the wound. And then while you're suturing, it should be 1 cm apart. And when you take a bite with the needle, it should be 1 centimeter of the wound's edge. So briefly talk about suture needles, because we can't use sutures without the needles. So generally, suture needles can be classified based on according to their shape. They can be straight or curved needles. According to the cutting edge, it can be round body or cutting needle. It can, according to the tip, it's round tip needles, they're blunt tip, triangular tip needles. And generally, suture needles are made of steel and they come in different sizes, different configurations, and they're used in different tissues to achieve different purposes. So also, the needles can be handheld or attached to the suture for use with a needle holder. The suture is attached, that's for the needles that come with the suture attached. It's usually attached by bonding. That's a type of connection we call switched or eyeless. And the needles come with a loop suture to avoid a knot at the end of a laparotomy. So straight needles usually are handheld and they are good for skin closure in some surgeries. However, they should be avoided because of risk of needle stick injury because you're holding it. Curved needles are usually more commonly used, and the commonest ones used are the 3/8 circle. That's how do I explain it? The because it's curved, is the like the body of the needle. There are different types. There's 1/4, there's half, there's 3/8. So it's based on how much of a circle it forms. So the 3/8 will form a quarter plus an extra curve. So 1/4 curve needle is usually used for microsurgery and ocular procedures, and in cardiovascular surgery, oral and nasal surgeries, the 3/8, half, and six circle curved needles are mostly used. So the compound curved needles, that's needles that have a straight point with a curved distal section. They're used for ophthalmological, oral, plastic, and vascular procedures. The round body needles are usually helpful in bowel surgeries, especially for anastomosis, while blunt point needles are used for securing hemostasis in the liver. So for suture removal, it's important to know when to remove your sutures, especially like that's for non-absorbable sutures, because you want to prevent infection and tissue reaction. So sutures generally usually are removed within 1 to 2 weeks of their placement, depending on the anatomic location, as different parts of the body heal at different rates. So you remove the sutures based on the amount of time you expect this part of the body to have healed. So for head and neck wounds, usually remove after 3 to 5 days. Abdominal wounds usually after 7 to 10 days. For the limbs, lower limbs and upper limbs, usually remove after 10 to 14 days, and for chests also 10 to 14 days, and for joints, the sutures over joints remove after 14 days, as prompt removal will reduce the risk of infection and tissue reaction. So now I'll talk about complications of suture use. A suture is a foreign body, so there are certain complications that are associated with use of sutures, such as wound infection. The site where you suture, the wound can become infected, and especially when we use multifilament sutures that have crevices where organisms can be harbored. So they are predisposed, they have a higher risk of wound infection. Also, it may slow down the process of wound healing. It may also cause wound breakdown, and because it's a foreign body, and maybe foreign body reaction. Certain individuals can also have hypersensitivity reactions to the sutures. And there's also stitch granuloma. A stitch granuloma is a mass forming benign lesions that usually develops at the site of the suture as a foreign body reaction to the suture. So it's like at that site. Also, there's suture knot sinus. And suture knot sinus usually is like a blind ended tract that is usually created from an infective process around the suture, and usually leads from the stitch to the skin surface where serous or purulent discharge materials may be discharging from. So what are other things that we can use as an alternative to using sutures? We can use staples. We've seen staples is like using a stapler, and usually these ones are used to close skin if you don't want to use the suture. We can also use clips, skin tapes like Steri-Strip, and tissue glue like cyanoacrylates. So in conclusion, sutures are used to hold body tissues together and they approximate wound edges after an injury or surgery. They are widely used in surgery and their importance cannot be overemphasized. Thus, understanding the attributes of each type of suture is essential. These are my references. Thank you.
Of all the properties you have added, you have mentioned, which one is the most important to the surgeon? To respect to wound healing to the surgeon. Respect to wound healing is the tensile strength
The Jenkins rule you mentioned for the rule of abdominal closure.
we use in closing anterior abdominal wall wounds. And the rule is aimed at one helping you to determine the length of suture you are going to use, or degree of approximation so that one opposed wound. It also helps you to prevent local devascularization of the sutured wound, to know where to apply bites in terms of distances